Okay, my name is Rudy Summers. I'm the student nurse from Southwest University that's going to be conducting your medical history and screening. Can we first start off with your full name and date of birth?
Edward Caruth, 7/22/94.
So that would put you at what age?
23.
Okay. Family physician or primary health care provider?
Dr. Gonzalez,
Marital status?
single,
And what gender do you identify with?
male,
How about education
college,
and occupation?
mechanic.
All right, I'm going to go ahead and start off, Mr. Caruth, just asking you some present medical history questions. If any of them pertain to you, just go ahead and answer yes, and I'll mark them off, okay?
Sounds good.
Has the doctor ever said that you have blood pressure that was way too high?
No,
And do you ever have pain in your chest or heart?
no,
Are you often bothered by a thumping of the heart?
no,
Does your chest often raise?
no,
Do you ever notice extra heartbeats or skip beats?
no,
Are your ankles often badly swollen?
no,
Do cold hands or feet trouble you even in hot weather?
no,
Has the doctor ever said that you have had heart trouble, an abnormal electrocardiogram like an ECG or EKG, heart attack or coronary?
no,
Do you suffer from frequent cramps in the legs?
no,
Do you often have difficulty breathing?
no,
Do you get out of breath long before anyone else?
no,
Do you sometimes get out of breath when sitting still or sleeping?
no,
Has the doctor ever told you your cholesterol levels were high?
no,
Has the doctor ever told you that you have an abdominal aortic aneurysm?
no,
Has the doctor ever told you that you have critical aortic stenosis?
no.
Now I'm going to ask you some different questions, and this has to do with anything that you currently have now, or you've recently experienced. Chronic or recurrent morning cough,
No,
episode of coughing up blood,
no,
decreased anxiety or depression,
no,
problems with recurrent fatigue, trouble sleeping, or increased irritability.
no,
How about migraines or current headaches?
no.
Swollen or painful knees or ankles?
Yes. It'd be right knee.
Swollen, stiff, or painful joints?
Yes.
And that's the same thing for the right knee?
Yes, right knee.
And where was the injury from?
Basketball.
Pain in your legs after walking short distances?
No,
Foot problems?
No.
Back problems?
No.
Any stomach or intestinal problems, such as recurrent heartburn, ulcers, constipation, or any diarrhea?
no,
Significant vision or hearing problems?
no,
How about any recent change in a wart or a mole?
no,
Glaucoma or increased pressure in the eyes?
no,
Exposure to loud noise for long periods?
no,
An infection such as pneumonia accompanied by a fever?
no,
How about significant unexplained weight loss?
no,
A fever that can cause dehydration and a rapid heartbeat?
no,
Deep vein thrombosis such as blood clots?
no,
How about foot or ankle sores that won't heal?
no,
Persistent pain or problems walking after you have fallen?
no,
Any eye conditions such as bleeding in the retina or detached retina?
no,
Any cataracts or lens transplants?
no,
Or any laser treatment or any other eye surgeries?
no,
Do you have any difficulty urinating?
no,
Any erectile dysfunction?
no.
Okay, I'm just gonna go ahead and ask you about medications, vitamins, or any herbal supplements. Do you take any?
Just vitamins. Men's one a day.
Just one day?
Yes.
Okay. And do you have any drug allergies?
No.
Okay. So just vitamins, you don't have no allergies to any drugs at all?
No.
Okay. So I'm gonna ask you about your past history, medical history. You have any heart attack,
No.
rheumatic fever,
No.
heart murmurs?
No.
How about disease of arteries?
No.
Varicose veins?
No.
Any arthritis with the legs or arms?
No.
Diabetes or abnormal blood sugar tests?
No.
Phlebitis, which is like inflammation of the veins?
No.
Dizziness or fainting spells?
No.
How about any epilepsy or seizures?
No.
Stroke?
No.
Diphtheria?
No.
Scarlet fever?
No.
Infectious mononucleosis?
Yes.
Okay. And when was this?
About 12 years old.
Okay. Nervous or any emotional problems?
No.
Anemia?
No.
Thyroid problems?
No.
Pneumonia?
No.
Bronchitis? Asthma?
No.
Any abnormal chest x-rays?
No.
Any other lung diseases?
No.
How about any injuries to the back, arms, legs, or joint?
Yes. It'd be the right knee.
So right knee injury. And this was around what time?
About freshman year, so about 14, 15.
Okay. Any broken bones?
Yes, right arm.
How old were you?
About 12.
Okay. Any jaundice or gallbladder problems?
No.
All right. Just gonna go ahead and ask you now about some past surgical procedures. Any overnight hospitalizations? Any serious injuries or fractures?
Right knee surgery.
Okay, right knee surgery. And if I remember, you said you were 15 years old when this happened?
Yes.
Okay. And then,
Also, tubes replaced in my ears, both ears, about when I was about 1.
About 1 year old.
Yes, and then also my right arm.
Okay, right arm. Oh, that's right. You said you broke your right arm. You're 12 years old. Okay. All right. And immunizations, which are all your, injections. You're up to date with all like your
Yes.
tetanus, and how about your flu shot? Do you take your flu shot every year?
Yes.
I'm gonna ask you some family medical history real quick. We'll start off with family members. If they're living, go ahead and give me their age and then their health, and if they're deceased, just tell me what age they died at and the cause of death. Okay, so first we'll start with your mother. How old is she?
43.
And her health?
Good.
Okay. Father?
He's deceased, and that was at about 39,
Okay.
and because he was sick.
Any siblings?
2 sisters. One's 18 and one's 14.
Okay. And their health?
Good as well.
All right. Let's go ahead and go grandmother on your mother's side.
She's 63, and health is good as well.
Okay. And your grandfather?
65, and health is good.
All right. Okay. Now I'm gonna ask you about family diseases. Have you or any of your blood relatives have had any of the following, which is including grandparents, aunts, uncles, but exclude cousins, relatives by marriage, and half relatives? Heart attacks under 50?
No.
Strokes under the age of 50?
No.
High blood pressure?
Yes.
And who's that?
Grandfather on my mom's side.
Okay. Elevated cholesterol?
No.
Diabetes?
No.
Asthma or hay fever?
No.
Any congenital heart diseases?
Yes.
Okay, and who's that?
Grandfather as well on my mother's side.
And heart operations?
Yes. Grandfather as well. Open heart.
Okay. Any glaucoma?
No.
Obesity?
No.
Leukemia or any cancers?
No.
Under age 60?
No.
Okay. Alright, we're getting close to being done. We're gonna ask any other risk factors for heart disease. Anybody? Do you smoke?
No.
No chewing tobacco?
No.
Drugs? Okay. Diet wise, what do you consider yourself a good weight for yourself?
About 180.
And what is the most you've ever weighed?
185.
Do you follow a particular nutritional plan?
No.
Do you ever drink alcoholic beverages?
Yes.
And if so, what is the approximate intake on certain beverages such as beer?
On occasions.
Wine?
No.
And hard liquor?
More than others.
At any time in the past where you were a heavy drinker, like consuming, consumption of 6 ounces of hard liquor per day or more?
No.
Okay, we're just gonna review some of this, your systems, and if you answer yes to this, we'll just go into a little bit more details, just asking, filling in some of the spaces below. Okay.
Sounds good.
Alrighty. Just overall in general, your health, how would you describe it?
Great.
And what are your weakest points of your overall health?
No.
Okay, we're going to start right here. Do you suffer from headaches?
No.
Have there been any changes in your vision in the past 1 to 2 years?
No.
Have you ever noted transient changes in your visual fields?
No.
Do you have a history of allergic symptoms?
No.
Do you have any history of hoarseness or any recurrent abnormalities in your voice?
No.
Is there a history of neck pain or stiffness?
No.
Is there a history of swollen glands in the neck?
No.
History of thyroid enlargement or any neck tenderness?
No.
History of persistent swollen glands of the neck, underarms, groin, or thighs?
No.
Any history, chest pain, shortness of breath, asthma, emphysema, COPD, cough, chest congestion, wheezing, or diminished exercise tolerance?
No.
Is there any history of exertional chest pain, angina, heart attack, congestional heart failure, tightness, burning, fullness, or any other unusual sensations noted with activity?
No.
Is there any history of skip heartbeats, inappropriately rapid or irregular heart rhythms?
No.
Is there a history of chronic or recurrent abdominal pain, ingestion, nausea, vomiting, diarrhea, constipation, or previous endoscopy procedures?
No.
History of belching of stomach acid, severe or recurrent heartburn?
No.
Have you ever noted any jaundiced skin, which is yellowish in color, or Coca-Cola colored urine?
No.
Have you ever noted any change in bowel habits, such as dark stool, diminished caliber of the stool, straining at defecation, or persistent feeling the need to evacuate the bowel unrelieved by passage of the stool?
No.
Have you or anyone in your immediate family, which is parents, grandparents, children, siblings, ever had any of the following conditions? Colon cancer,
No.
colon polyps,
No.
familial adenomatous polyposis,
No.
other major abdominal diseases.
No.
Have you had prior colonoscopy, flexible sigmoidoscopy, or upper endoscopy?
No.
Okay, is there a history of bladder or prostate infections?
No.
Have you ever been told of prostate enlargement in the past?
No.
Do you have a history of diminished size or force of urinary stream?
No.
Is your sexual performance adequate? Are there any symptoms that concern you, or would you like to that you would like to further investigate?
No.
Is there any history of chronic or recurrent joint pain, swelling, or stiffness, or redness of any of your extremities? Is there a history of muscle weakness, tenderness, or a loss of muscle mass?
No.
Is there a history of unexpected change in fingernails or toenails?
No.
Is there a history of pain in the muscles of the legs with walking that quickly clears with cessation of activity?
No.
Is there a history of color or temperature changes of the hands or feet?
No.
Okay. Is there a history of motor sensory abnormalities, any in all over your body?
No.
And is there any history of unusual levels of anxiety or depression?
No.
Are there any other medical or any other history that we haven't included?
No.
Okay, awesome. Well, we'll go ahead. This will conduct your screening and your medical history. Thank you for your time, and we'll go from here. Okay.
All right. Thank you.
All right.